the day, World AIDS Day, we are now joined by Nqobile Shabalala, the Capacity Building Coordinator at Treatment Action Campaign. Nqobile, thank you so much for your time and joining us this evening. Now, South Africa has made very remarkable strides with regards to HIV and AIDS. What would you say are some of the notable efforts that have led to this progress?
Yeah, thank you very much. Good evening to you and the viewers at home. Yeah, there's a number of things that have been happening with our government. As we know that in South Africa, we are using 95 targets to measure the impact of HIV response. So looking at the 95 targets in terms of looking at the HIV response, we can see that the country is trying to come okay, as much as we haven't reached the goal that we want to reach as a country, but we are going somewhere. As much as we are being stopped or we are being hindered by some of the challenges and the issues related to a number of challenges that we identify at the facility level, but we are doing well. But there are things that we still need to do as a country in terms of making sure that we push these targets, and we push these targets also not looking at the quantity but looking at the quality of it.
I mean, you make mention of challenges, and I want later for us to discuss those at facility level. But earlier on in his address, our Deputy President, Mr. Paul Mashatile, made mention of older men who are sexual predators towards young adolescent girls. How much of a problem is that in the spread of new infections of HIV and AIDS?
Yeah, if you look at the HIV infection rate now, amongst age group, in terms of age group, most of young girls between the age of 14 to 24 are the most infected people in South Africa now, and the newly infection are amongst that age group. And if you look at the men, it's older men that they also show a high number of high infection. If you look at now, definitely we can agree to say there's a serious issue of older men dating young women and infecting them in this country. Remember, one of our challenge as the South Africans, we are having our country. Most of communities are poor. Most of communities they live below the living wage, and you find that young girls they end up dating or sexually abused by older men. Using money and using some materials and everything that they can use. And remember, when those older men, they date young girls, the young girls, they can't use any prevention method that they might need to be applied. So they end up agreed to any kind of sexual activity that may happen to them. And at the end of the day, they end up being infected by HIV and AIDS. That's why now we are looking at that, and we see such stats. And we have seen also with some programs that we put to speak to young girls, especially a project that is called Adolescents, Young Girls and Women. So they call it AYGW, program. It shows that program that, especially for girls in school and girls out of school, that it is the high number of girls who tested positive between that age of 14 and 24.
Very interesting. I mean, like you mentioned earlier on, that there are some challenges that you as an organization face. What are those that stand out for you, especially in the work of trying to lessen that prevalence of HIV and AIDS within all our communities?
So there's a number of things that need to happen, and that will need advocacy. One of the challenges that we are having in this country is what we call a facility-based stigma, where you find a person will go to a clinic, and at the clinic they will have a certain room to say, at that room we are treating people that are coming for HIV and AIDS. And when they start to practice that kind of stigma, people they tend now to disengage from treatment. So these are some of the challenges. We've got serious challenges that are related to staff attitude. We also have challenges that are related to shortage of staff. We've got a number of things that are happening in this country when it comes to our challenges. We've got also challenges where people are being denied treatment. We've got also challenges where people are supposed to be given a multi-month dispensing or multi-month supply, especially those who are stable on treatment. But you find that patients are still given a 1 month supply, and at other facilities, patients are still given one container to share it, and then people need to come to clinic twice per month or 3 times per month treatment. And remember, these are people that they don't have money to go to clinic. And we still have clinics that are far from communities, especially if you go to in rural areas. You find that there's people that they need to spend up to between the range of 60 Rand and 100 Rand to access their medication. And if the person doesn't have that money to access the medication, then that person end up disengaged on treatment. So we've got a number of issues that we are facing as a country in terms of challenges that we are facing to get our medication at facility level, including issues that speaks about enhancing adherence counseling. Some people, remember now we are speaking about test and treat. People, they test now, they get their medication. Some of the people, they start medication without even understanding how to take the ARVs. And then those people, they end up disengaged from care because we don't have people that they do enhancing adherence counseling, because we need to educate people about the treatment. They need to understand how to take the treatment. They need to understand the science of this treatment. That's why now we need to speak about a number of things like treatment literacy. So we need to go back to our roots where we used to provide treatment literacy. Treatment literacy trained many people. Even illiterate people, when we train with treatment literacy, they end up understanding their medication, because that's the one thing that needs to happen in this country, to make sure that each and every person who's taking ARVs understand the ARVs. As much as we have the best ARVs now in the country, we've got the best guidelines in South Africa, but we still need to ensure that those guidelines are implemented accordingly, and all the rules that need to be followed when they implement the guidelines are happening. Because if you put a person on treatment, but the person doesn't understand the treatment, there's a high chances that the person may end up disengaged on treatment. Mm-hmm. So those are some of the things that we need to look to the budget. They affect our people that the retention and care. So those are some of the things that we need to deal with it.
Most certainly. I mean, speaking of those challenges, surely there may be ways in which partnerships can come into play between advocacy groups, government, the private sector. Are there programs that are in place in ensuring that there's access of that treatment, especially in those rural areas that you make mention of?
So definitely. We need to look at, I'm looking at 5 things that need to happen in this country to ensure that we deal with that one. We deal with such issues. The first one is the prevention and treatment literacy. We need to bring back the prevention and treatment literacy, because the prevention and treatment literacy, it speaks about the usage of condom. It speaks about access to PrEP. We know that PrEP now is one of the drugs that is being used to ensure that if there's couples, discordant couples, they want to have a baby, the other one can take the PrEP so that they cannot infect each other. It also can prevent young people who can engage on sexual activities, who are engaging in sexual activities, that they don't use condom, to ensure that they take PrEP. So we need to apply such things. We need also to conduct HIV testing. So you see, once we start to apply, we go back to prevention and treatment literacy. We need to understand the science of HIV. We need to understand about the advanced disease. So we need to go back to study, to educate and empower people with this treatment literacy. The second one, we need to conduct capacity building. When we speak of capacity building, we are looking at issues that people need to understand, the health politics. We also need to look at the political parties' health manifestos during the election, because these are the things that mislead us as communities, so that we know what this political party are they looking for when they come and tell us about our health. We need to have a proper and clear strategies of how to fix the public health care system in South Africa. So that's why we need to engage with these people. We also need to understand the National Health Act. What does the National Health Act say about us? We also need to emphasize and fight for the implementation of the National Health Insurance, because we see the National Health Insurance as one of the things maybe that they can change the status quo of this country. We also need to ensure that the ART guidelines, everyone understand the ART guidelines. Those are the things that we need to ensure that are happening in this South Africa. Mm-hmm. And we need to also to go back to our roots in terms of our community awareness campaigns, because we have lost a momentum in terms of conducting community awareness campaigns, where we need to speak about HIV prevention, where we need to speak about even the 95-95 campaign. We need to speak about the undetectable is equal to untransmittable campaign. So these are the things that we need to do. We also need to adopt hotspots like shippings, hotspots like taverns, hotspots like schools, because these are areas where most of sexual activities are experienced, and where people most of the time when they engage on sexual activities, most of the time they don't use protection. So we need to get these places adopted,
out there
provide
as much as
education
possible.
with this.
Of course, of course. Sorry to come in there, Mr. Shabalala. I mean, you keep mentioning going back to our roots. We do know that there was a time in the country where everywhere you turned, there was this mass communication around HIV and AIDS, whether it was storylines on television, whether it was public service announcements. It was there and it was educating our nation. Like you keep mentioning, it seems as though we've put the foot off the pedal. Why do you think that is so? And if we hadn't put that foot off the pedal, do you think that our numbers in declining that prevalence in HIV would have been better than where they currently stand?
In terms of newly infection, if we continue what we used to do, we're going to be, the new infection we're going to decline, drastically decline, because there were a lot of education in the yesteryears about HIV and AIDS. But if you look now, even the level or the standard of HIV testing is no longer the same standard that was happening around 2009, 2010, 2012. So we need to go back to such interventions, look those interventions, because those interventions are the ones that they made people to go and test for HIV. Those campaigns that we used to do, going to commit awareness, are the ones that made people to test. If you look at the COVID-19 in 2020, especially in 2020, where everyone was speaking about that, everyone tried to stay away from COVID-19, tried to avoid COVID-19, tried to apply all the prevention measures that was put before COVID-19. So we need to go back to speak about the prevention method. We need to go back to speak about the treatment, the HIV treatment. We need to go back and speak about such things. We need to make sure that those things, they come back, we put it back there. Because once we put such things, we put such information, because those were key information in terms of changing the status quo of HIV and AIDS. Many people in South Africa learn, understand, and have information about HIV and AIDS based on such information. But the younger generation that are coming now, they don't get such a privilege that some of us we used to get in the yesteryear in terms of being educated about HIV and AIDS. So we need to go back and start to emphasize about training and education and empowering communities around issues related to HIV and AIDS, especially HIV prevention.
Most certainly, even though the numbers have gone down by 2%, there certainly is a lot of work that still needs to be done in lowering the HIV and AIDS prevalence within our country. Thank you so much for your time and for your insights this evening. That was Treatment Action Campaign's Capacity Building Coordinator, Mr. Nqobile Shabalala.